The preschooler examination begins with an interval history and eliciting the parent's concerns. Family, social, emotional, nutritional, and developmental history, including intellectual and verbal development, is also assessed. The family history should include the health of all siblings. There may be a new sibling in the family, which makes you think about issues relating to sibling rivalry and family stresses. The 3-year-old has understandable speech and can answer simple questions you ask. Here, the examiner is asking how the child got the blackened eye. Observe the child-parent interaction. Ask about obvious bruises or lesions you notice. During the interview and physical exam, the healthcare provider is building a relationship with the child and parent, as well as gathering data to make a thorough assessment. Developmental assessment can begin with a Denver test, which is discussed later in this course. The Denver test assesses fine motor skills, as with the block building, as well as gross motor, language, social, or personal skills. This 3-year-old can easily build a tower of 6 to 8 blocks. Assessment of the height and weight comparing to the child's previous measurements is documented on the growth chart and discussed with the parent. Respiratory rate and heart rate is also assessed as part of the vital signs. Normal respiratory rate for the 3-year-old is 18 to 30. Normal heart rate is 80 to 120. Blood pressure should be taken with an appropriate sized cuff on children 2 and older. Normal pressures are around 100/67. Refer to standard charts in your textbook. Preschoolers are normally very cooperative, and you can start the assessment in a head-to-toe manner. Palpate the head and neck, noting skin abnormalities, masses, and areas of tenderness. Palpate and note the size, consistency, and tenderness of the lymph glands. Examine the eyes for equality of the light reflex in each cornea. Do the cover and uncover test to assess for strabismus. Untreated strabismus can result in amblyopia, which is the most common cause of visual loss in American children. Cover one eye without touching it, and then watch for movement when it is uncovered. You will be practicing this test in your clinical practicum during this course. You may be able to get a cooperative 3-year-old to do a Snellen test. Usually they must be closer to 3.5 years or older. Direct and consensual light reaction is assessed. Inspect the upper, lower lids, sclera, and conjunctiva. Ophthalmologic examination should be completed in a darkened room. It is difficult sometimes to get the 3-year-old to focus on an object. Be sure you visualize the red reflex. Palpate the sinuses and nasal area for tenderness. Check for patency and examine the nasal mucosa for color, deviation, and presence of polyps. Inspect the mouth and teeth carefully. Note the number of teeth and their condition. Preschoolers should be referred for routine dental care. Continue supplemental fluoride if this is not in the water supply. Check for appropriate dosage of this medication depending on the amount in the water supply. Remember also that some children may be receiving this medication in preschool or Head Start programs. Observe the tongue and buccal mucosa, the palate, posterior pharynx, and tonsillar area. Be sure to explain and show children what you are examining. They will be much more cooperative. Inspect the ears, the auricle, external canal, and the tympanic membrane. You may be able to do a pure tone audiometric evaluation on a cooperative child this age. as well as impedance audiometry. Observe and palpate the thyroid gland. Palpate the nodes of the neck, checking for areas of tenderness and size of lymph nodes. Begin the cardiac exam. Inspect and palpate for the PMI. Listen for S1, which is louder than S2 at the apex, and S2 being louder than S1 at the pulmonic area. Listen for murmurs. Auscultate with the diaphragm and the bell. A heart rate that is faster on inspiration and slower on expiration and PVCs are common. If you hear a heart murmur, note the frequency, either high or low, the intensity, loud or soft, duration, short or long, and timing, either systole or diastole. You have the opportunity to listen to heart murmurs when studying cardiology in the primary care course. Inspect the movement of the chest wall. Document the respiratory rate if not previously done. Normal respiratory rate for a child this age is approximately 23 to 25. Auscultate all 5 lobe areas throughout the full inspiratory and expiratory cycle. Percussion will reveal hyperresonance in a normal lung exam. Again, be sure to compare one side to the other. Palpate the spine for any deformities and areas of tenderness. Palpate the rib cage for tenderness. Remember, through the entire exam, you should be observing the skin for any abnormalities. Complete the lung exam by percussing the posterior chest area, comparing one side to the other, and again, auscultate, comparing one side to the other. Listen through full inspiration and expiration. You can check for general respiratory excursion by placing your hands on the rib cage and observing the equality of movement as the child takes a deep breath. Again, always explain to the child what you are doing. Complete the cardiovascular exam in the supine position. When assessing any heart murmur, document your findings in both the sitting and the supine position. Note the cooperation of the preschooler. Listen to the heart in all 4 valve areas: the aortic, pulmonic, tricuspid, and mitral. Listen with both the bell and the diaphragm. If the child seems uncomfortable, reposition him. Preschool and school-age children are fascinated with listening to their heart. Tell them to listen to the lub-dub and also to check the gurgles in their stomach. Inspect the abdomen, the contour, the color, check for lesions and any masses. Auscultate for bowel sounds in all 4 quadrants with the diaphragm. Percuss the abdomen, checking for normal tympany and appropriate areas of dullness, such as over the liver and spleen area. Palpate for abdominal masses, including palpation of the liver in the right costal margin, a liver edge palpated more than 2 centimeters below the costal margin is usually abnormal. The spleen in the upper left quadrant is often palpable in children. Palpate the kidneys for any abnormal masses or tenderness. Check the femoral pulses and compare to the radial pulse as explained earlier. This is a test for aortic coarctation. Again, the examiner is palpating the kidneys to complete the abdominal exam. Check for range of motion of the hips and knees. Leg lengths are measured for equality as well as checking for equality of knee heights. Unequal leg lengths or any pain on movement should be further evaluated. The Ortolani and Barlow maneuver is not done for this age group. Remember, as you are doing the examination, you are observing the skin. Note the bruises on the shin, which is common for the active 3-year-old. Range of motion of the ankle and thorough examination of the foot is done. Further musculoskeletal examination will continue with observation of gross motor movements later in the exam. Once the child is up and moving, it is more difficult to get them back on the table. So complete the examinations you need to do while on the table at this time. Reflexes can be checked using the reflex hammer. Again, children are interested in the tools you use, so allow them to briefly explore these. Check the biceps, brachial radialis, and triceps if possible. Repeat reflexes on the opposite side, always comparing one side to the other. The lower extremity reflexes are checked either in the lying or sitting position. The patellar reflex, and the Achilles reflex. The Babinski reflex should be negative at this age. Again, examine the spine in the standing position and observe the skin of the buttocks area for lesions or bruising. Back flexion can be checked asking the child to touch his toes with his fingers. If you are concerned regarding muscular dystrophy or abnormal muscular development, ask him to rise from a lying position. A normal child will first sit, flex at the knees, and then push off from the floor. The genital exam can be done at this point of the exam or on the table after the abdominal exam. Check both testes to be sure they are descended. Check the scrotum for masses and the position of the urethral meatus. At this age, the foreskin should be easily retractable. Be sure to return the foreskin to its normal position after the examination. The neurologic system can further be evaluated by asking the child to balance with both feet together and then to stand on one foot at a time. A 3-year-old can usually balance on one foot for 1 second. Broad jumping is also a task tested on the Denver 2. Ask the child to jump over a piece of paper. The 3-year-old accomplishes this well. The 3-year-old also easily throws the ball and enjoys games. In review, the Well Child exam should include addressing parental or caregiver concerns, taking an interval history, family and social history, and doing the complete physical exam, which includes the developmental assessment. The child should be able to speak in short sentences, use plurals, separate from the parent easily, perhaps ride a tricycle if he or she has the opportunity. Injury prevention should again be emphasized with the parent. Discuss the age-appropriate car seat, issues related to water such as canals and swimming pool safety. Kitchen safety should include keeping knives and hot utensils away from the child, as well as poisons, medications, and household products, which all should be locked. Question families about guns in the home and appropriate storage or removal. Nutrition and appropriate snack foods are discussed. Dental appointments can be scheduled and appropriate brushing and flossing discussed. Immunizations may need to be given if they were missed. Refer to appropriate immunization schedules in the readings.